Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online, news that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Hello and welcome to Newsmakers. I'm Anthony Moreno. This week we hear from one organization who's raising concerns about how federal funding cuts may impact a mobile vaccine program in Doña Ana County. But first, we learn how one organization aims to strengthen communities through service and conservation. Producer Courtney Hill has more about the work of Conservation Corps New Mexico in this Community Connection.
Conservation Corps New Mexico is a nonprofit that's affiliated with AmeriCorps, a federal agency which enables us to engage our communities to recruit young Americans to do various project works that's related to conservation or environmental and even disaster relief missions.
Roswell was affected by a flooding event. I believe they said somewhere around like a 200-year flooding event. They received 6 inches of rain in a couple of hours, which is about half of their yearly rate. Once that happened, things go into effect. It's first, checking on people, making sure that they're safe, and then later on it goes into recovery, and we're part of that recovery operation.
But I kept watching the water come up on the walls, and it got about 2.5 feet inside the house. And I got a phone call a couple of times, "We can come and help you." And my neighbor across the street said, "Megan, you need to call him back." Okay, so I did. And lo and behold, this morning I was so excited, I jumped up out of bed and knew I had to hit the floor running. And these nice young people came and have worked their tails off. Today they have removed the particle board and some of the subfloor in my kitchen and bathroom. The others have gone out. There was like 3 or 4 inches of mud on top of my patio. I didn't know if I'd ever see it again or not, and they've dug it out, cleaned it up, they've picked up leaves, and they've thrown trash and stuff away. We've got a bunch more to do, but man, how exciting all this is.
That's been the most special part, is actually getting to interact with the people that we're assisting, and just seeing the damage from the floods and the before and after has been really rewarding.
So normally we do what's called a muck and gut. It's where we would go into a home that was flooded and we will take out the drywall, insulation, everything that got wet. And we also do mold suppression a lot of the time, so we'll go through and spray a home after it is muck and gutted. We also do, as you can see, tons of debris removal. This is from a shed back in this homeowner's yard. Just stuff that was damaged from the flood that she's not able to access safely.
So Texas Conservation Corps and Conservation Corps New Mexico, along with other Corps programs, habitually work in partnership or a collaborative effort to make sure that projects or missions are done with satisfaction to meet the needs of the community.
But it has been great making connections with homeowners. We've had quite a few heart-to-hearts for sure. Still getting messages from some of the homes that we completed from those homeowners, just checking in with us, which has been great. But yeah, it's been a great experience for sure to see how much progress we can make.
The homeowners is what's important to us here, and the overall response has been extreme thankfulness. Roswell has really opened their arms to us, and it's been really nice.
Come to find out, this is part of YCC that I worked at when I was in high school, so it's like they're giving back to me for the time that I spent being in that, and so that's been a commonality we found with each other, and so it's been a great day. I've enjoyed it very much, and I appreciate all these people coming to my rescue. They're angels.
Moving on to our featured conversation, federal funding cuts may have halted a mobile vaccine program in Doña Ana County. Daisy Maldonado, director of the Empowerment Congress of Doña Ana County, joins us now to share more. Daisy, thanks for joining us.
Thank you for having me, Anthony. Glad to be here.
I'd like to start off by learning a little bit about this mobile vaccine program. Can you share with us a little bit of history behind it?
Yeah, so it really was born out of the COVID campaign, and so the New Mexico Department of Health has funded a mobile vaccine clinic to travel all over the state to provide vaccines, in particular COVID vaccines, but also flu and other vaccines, to communities that otherwise don't have access to a vaccine.
So how has that played a role and made an impact in Doña Ana County?
Well, through our program and with Empowerment Congress, we applied for some funding to continue and expand our programming around vaccine information. So that's what we had been doing since the beginning of the pandemic, is sharing information about COVID vaccine and how to access it with the Colonia communities here in Doña Ana County. And so with additional funding through the Better Together Coalition, we were able to partner with the mobile vaccine clinic, the New Mexico Department of Health mobile vaccine clinic, to come from Albuquerque, essentially, to come into the Colonia communities and support vaccine clinics, again, where folks don't have access to a vaccine because of their doctors don't carry it, or they don't have a commercial pharmacy in their area, and other barriers like that.
Barriers, you're mentioning folks who may be living in rural communities, is that correct? And just how that may play a role in them gaining access?
Yeah, absolutely. So part of the reason why getting a COVID vaccine could be difficult is because it requires refrigeration. And so if a vaccine is made available but not used, then it's just thrown away. And in areas like La Union, let's say, right, we've all been in that small colonia, what exactly exists out there, where they could actually maintain proper refrigeration to store a vaccine, a COVID vaccine. The fact of the matter is they do not have that. So that's why a mobile clinic is really advantageous in that community, because they can, those folks can travel to La Union, they can, take those vaccines out of refrigeration and then make them available on that day, for the individuals that show up to get that vaccine. And the other thing too is that it's free of charge.
You mentioned free of charge. Obviously, there has been some costs now associated with some of these vaccines in many traditional medical spaces. So having the opportunity to get free access to a mobile vaccine program that may show up to your community, how does that play a role in public health in these rural areas?
Yeah, again, so those individuals might have, or in those, let's use La Union again as an example, that community doesn't have a commercial pharmacy, they don't have a doctor's office, and so access to medical care, is very difficult. And so they might travel to El Paso to get some of those services, but if they're on New Mexico Medicaid, they wouldn't be eligible for that, or if they don't have insurance at all, it'd be very expensive. So having free access to this vaccine is actually critical to the community health.
Can you give us an idea of just how many people were helped by this program?
Yeah, so when we applied for the funding originally back in 2022, when we started the program, the first year was a little over 400 people that got a free vaccine. The second year was over 500, which we're really proud of. Again, and this is, I'll say, so La Union is just one example, but we visited places where you wouldn't think of, right? So we've hosted vaccine clinics inside gas stations. We've gone to the, the panaderia. We've gone to the farm, directly to employers, vaccinated farm workers. And so that's been part of the success, is that working with the mobile clinic, they'll also go anywhere with us, which is great. But we set up the venue, right? We work with the venue itself to be able to provide those services. And this last year, unfortunately, there's been a reduction in funding. So thus far, for this fiscal year, we've only vaccinated 199 people. I wish that was a little higher. But right now, we actually have a few vaccines going on.
Now, Can you share a little bit more about what you know about the funding cuts and how that played a role in potentially limiting this mobile vaccine service that has been available, and you mentioned the numbers already that have been happening. So what do we know so far, and just how is this going to impact the program?
Yeah, so the funding essentially, it's CDC money. So coming from the federal government, going to the states, and then the states deciding how they're going to spend it. And so the money that was designated for the vaccine clinic itself, for the mobile clinic, it went, that got a little bit reduced this past fiscal year. And so they weren't going out as much. But for the funding directly for our program actually got cut last month. And so on a Thursday, we got an email basically saying, your contract is terminated with the Department of Health. Stop all programming, stop all invoicing, like don't spend any more money. And actually the program ended last Friday. So send everything in and you'll get paid through last Friday. And the program's basically over.
So this sounds like it was a shock to you a little bit.
Yeah, for sure. I mean, because we definitely had the contract that was supposed to be until June of this year, right? This fiscal year. And so, yeah, I mean, we had plans for more vaccine clinics, for more outreach. And it was definitely a big shock to say, we're not going to send you more money to do this very critical work.
What are some of your thoughts about this program ending and how it's going to impact public health in these rural areas?
Yeah, exactly how it's going to impact these rural areas. I think it's quite unfortunate, right? And I think it'll have a huge impact again because these are individuals that just don't have access to a vaccine. And if they could have access to a vaccine, then they wouldn't need, a mobile clinic to show up in their neighborhood at the community center or the gas station, right? And so I think there'll be less people who are getting vaccinated, which means that COVID cases will continue. And you can get COVID at any time. People get it in the summer, in the fall. So I think that'll increase, which means there'll be more individuals who are sick who go to the hospital. So there'll be more hospitalizations, and then it's just sort of a ripple effect after that.
With folks in these rural areas, is there some concern that they may not go to the hospital unless it's a situation where they are very, very sick or seek medical attention? So what are your thoughts on that?
Yeah, well, right, and that's actually something in terms of Empowerment Congress's work is what we've advocated for is just more medical services in those communities because of the limited access, right? And you're right, people aren't going to seek out services unless, they're almost dying, right? And so I think that's a real concern, again, for our hospital system, because even if, again, we'll take La Union as an example, it's actually closer for them to travel to El Paso, right, to get to a hospital. But again, if they're on Medicaid or they're indigent, they might not be accepted at those hospitals. So I think they can be in very critical situations, and they otherwise wouldn't have to have had been if they were vaccinated.
What has been the response from the communities that you're working with on how they are becoming more educated about how vaccines play a role in public health?
Yeah, they really welcome the information, and I think we are still battling some misinformation, to be honest. There's lots of people who are still believing that, there's some sort of controversy around vaccines and some, bad things would happen to them. And once they understand, and that's also part of the the benefit of our model, utilizing community health workers to be the frontline messengers, trusted messengers in the community who say, I've been vaccinated, and this is actually why it's important for all of us to be vaccinated. And so the response has been actually really incredible, and people are ready to get vaccinated once they know the information and they know from a trusted messenger.
How has your organization been in working with local communities in these rural communities, colonias, about public health and education surrounding public health? Can you share with us a little bit of a little bit more about the work that your organization is doing.
Yeah, well, and again, so we employ 8 community health workers, and they all sort of work in a territory, and then we talk, they provide public information about different health topics like vaccines and diabetes and mental health and other health related information. And again, people are they're really responsive, and they're hungry for that information. And so again, specific areas, and they're interacting with people in different places. And I say we put ourselves in the way of where people already are. So we don't ask them to come to us, we go to them.
How does that approach make a difference in reaching and connecting and educating folks about the public health needs in each community and concerns surrounding public health?
Yeah, I mean, again, it's made a huge difference, I think, in reaching people that normally they wouldn't go to the doctor, right? Maybe they don't have a doctor, maybe they don't have insurance. Individuals who might, meet undocumented or other documented. And so when we're there, it's a very unthreatening, situation. We're here to talk, and here's some information, and you need to get connected to something, and this is why taking care of your health is so important. So it just made a world of difference.
As we're talking, New Mexico, Texas, and other states are dealing with a measles outbreak.
Yes.
There's a lot of concern about that. Right before we take this conversation, we learned about a case in Doña Ana County. We, of course, have heard news about cases in El Paso as well. What are some of your concerns about how this is going to impact Doña Ana County, especially the rural areas?
Yeah, I'm really, really concerned, actually, because again, individuals might not know their vaccine status in terms of if they got the measles vaccine when they were a child or a baby. And then to get a vaccine, they have to go to a public health office, which means they have to travel to Las Cruces. And that might not be feasible for them, and it might not be as important, right? And a lot of times when we're having these conversations with folks, they think, oh, I'm not the person that's going to get sick, or it's not going to happen to me. I'll stay safe. I'll keep my kids safe. But measles is an incredibly, infectious disease, or contagious rather. And it's actually more contagious than COVID. And so, we're really pushing out that information that, we all need to figure out what is our vaccine status, and then figure out if we need to go get vaccinated. And we're behind the scenes talking about that. How can we help facilitate a process so that people who aren't vaccinated can get a vaccine?
How do you feel that local governments, state governments, people working in public health could really successfully bring this education about the need to vaccinate people against all of these elements and diseases that we're talking about? Is there a message right now that might be missing?
You mean from the local government?
Mm-hmm.
Yeah. I don't know that it's necessarily a message. It really has to do, again, what I really believe it has to do with access. And so I think the messaging is fine. It's just how do you make it easier for somebody to get access to a vaccine? And I think local government can do a lot. I'll be very frank with that. They could do a lot more, and they choose not to. We open from 8 to 5. You need an appointment. You have to come to us, and that just doesn't work for community.
One of the things that's on my mind as we have this conversation is the impact that transportation has on our communities, and having access to transportation. How crucial is that issue in Doña Ana County in regards to just kind of closing the gaps in public health?
Yeah, I think it's huge, because again, Empowerment Congress, our focus really is on the southern part of the county, and we go all the way down to Sunland Park, right? But Sunland Park, Chaparral, and Anthony all have a public health office, but they don't have the vaccines. And again, part of it has to do with refrigeration and other issues. And so again, they still would have to travel here to Las Cruces. And I'll give you one example too, that so the Gadsden School District, they every Wednesday they have a short day, right? So they get out, I think they let the kids out at noon or 1 o'clock or something like that. And so our community health workers in Anthony have said that work in Anthony, like when we bring vaccine clinics to Anthony, let's stay open, or let's do it from like until 4 o'clock or until 5 o'clock, because the kids coming out of school can then be brought by their parents here, right? They don't have to go all the way to Las Cruces. Or even as far as Sunland Park, driving to Anthony is a lot. You know, it's an easier drive than trying to come all the way up to here to Las Cruces. In any case, right, to get those young people vaccinated. So yeah, so transportation is a huge barrier.
What are some of the conversations that are happening right now with your organization and public health advocates in our area about how can this program stay alive? Any ideas or thoughts there?
Yeah, I mean, besides just raising our own money, you know, for me, my thoughts just go with how we need the state to sort of step up and provide some, you know, fill in that gap, as well as how are we just going to raise the money ourselves, and, you know, provide that, again, to continue the employment of our community health workers, to provide that information to the community, but then also just gain access to vaccines. And again, the issue is just the refrigeration piece. So even if everybody got together, so we'll buy the vaccines, but then where do they get stored and who administers them? And those are the pieces that seem to be a little bit more difficult and are really on the medical side, and that unfortunately the local public health piece hasn't really stepped up to try and solve that, so that part of the problem.
Having a public health infrastructure is so crucial for many of these communities. Why do you think these communities have been left behind in some areas?
Yeah, I mean, I think part of it, you know, just being smaller, you know, smaller communities that just don't have the time or, you know, the understanding of those how these bureaucracies work and how to advocate. But also, again, I think I don't know if it's easy is the right word, but, you know, that's just the status quo, right? And that's just the way we do our business. So again, 8 to 5, this is how we function. Like, don't ask us to do more because we're fulfilling sort of our role, and not trying to sort of think up outside of the box about how we can serve our community in a different way that actually would meet them where they are, you know.
When you look at perhaps other communities in rural areas, perhaps in other states, is there anything that you're noticing where they're having some success with this issue? Any possible solutions out there to kind of fill these gaps in public health in our rural areas?
Well, for sure, I mean, mobile clinics, right? Hands down, mobile clinics would be the easiest, fastest solution. And then mobile clinics that have, you know, specific hours that are really feasible to working people. You know, again, not 8 to 5 and not like come to us. It's, you know, 4 to 9 and we come to you, like wherever you are.
Your organization works with a lot of colonias, as well as youth in Doña Ana County. When you talk with folks in these communities, especially the young people, what are some of their concerns that you're bringing up to your organization?
Yeah, I mean, the young people are special because sometimes they feel like, you know, that the adults in their community and in their lives actually aren't listening to them, right? And so there's lots of fear and concern about the future, like what exactly is happening. But then the adults in the room, you know, or at school aren't really having those discussions with them. So there's a general fear and anxiety among young people about the future. And so when we sit down and we do talk about it, they're almost like they can't even think about solutions because they're just sort of, you know, in their fear about, well, we don't know what's happening and nobody's telling us what to expect. There's lots of uncertainty.
It kind of makes me wonder when you're in a position like that where there's a lot of uncertainty and you don't feel like you're being heard, what does that do to, you know, your hope for the future? Mm-hmm. Any thoughts on that? Yeah,
well, again, the young people, that's sort of the situation they find themselves in, and lots of them actually don't have hope for the future. You know, they say, well, whatever's going to happen is going to happen, and you know, none of it really matters, and I'm going to just do whatever I want.
How does that play a role in actually being able to move forward on some of these challenges that our communities face?
Yeah, well, right. It's very difficult. Well, and so in Empowerment Congress, we tried to give them, like, not necessarily a solution, but something to do, right? And something to have hope for. And that's really where we've, you know, opened the door to, you know, community art. So, like, let's come together, and this is how you can create, you know, hope for your future, but, or like impact where you are now, and make a contribution here, you know, today. And so then we have some public art pieces, you know, around the county. But it's a little difficult, yeah, with young people, because I don't know, it's just sort of like in the air. I feel like it's all the kids.
Well, there's certainly, I mean, obviously we've talked to a lot of people who are concerned about a lot of things happening and uncertainty out there in many different areas. Of course, with federal government, state government, our local governments, there's been plenty of concern with that. When you do have those projects where you do bring people together to find a common goal, perhaps it's an art piece, what does that do for community pride or confidence within those taking part in that issue, when they actually can come together and see a result about something?
Yeah, yeah, it's sort of, again, it's sort of night and day, and people really feel proud to be where they're from. You know, and last year we actually had an intern who lived in Mesquite, but she moved from El Paso, but she still went to, you know, graduated from a school in El Paso. And just from spending, you know, 2 months with us, she said, I really feel now a sense of pride, you know, from being from Mesquite. And now when I go back to school, I'm going to tell people I'm from Mesquite, so I'm from El Paso, you know?
Oh, wow.
Yeah.
Wow. Daisy Maldonado, Director of Empowerment Congress at Doña Ana County, thank you for joining us.
Thank you, Anthony.
And we want to thank you for joining us for this week's episode. Remember, you can always stay updated with news at krwg.org, our website. I'm Anthony Moreno. We'll see you next time on Newsmakers.